Here to help. VETS. Contents. I am a vet. Page 4. Checking my patients. 6. Medicines and instruments. 8. My first appointment. Page 10. More appointments. 12. Scanning. 14. Operations. 16. Making phone calls. 18. Out and about. 20. Helping animals. 22. When you grow up and answers. 23. Glossary and index. Page 24. Words in bold are in the glossary on page 24. I am a vet. So, my name is Nafisa and I am a vet. My job is to help people keep their pets healthy. I treat lots of sick and injured animals every day. What types of animals do vets help? Many other staff work at our surgery. This is Nicole. She is one of our vet nurses. She helps me look after the animals. Pearl is a receptionist. She welcomes pets and owners into the waiting room. Pearl answers the telephone and makes appointments for my patients. Checking my patients. My first job each day is to check the hospitalised pets with Nicole. These patients are not well enough to go home and have stayed overnight at the surgery. Rufus is looking much better today. Why do you think vets need nurses to help them? We make sure the animals are eating and drinking properly. We also check the temperature and heartbeats of some of the animals. Bert had an operation yesterday. His leg was injured and had to be stitched up. I examined Bert's leg to make sure that the stitches are still in place. Medicines and instruments. Rufus needs 2 tablets a day. Twice a day. To help some animals get better, I have to decide which medicines to give them. I tell Nicole which medicines should be prescribed to each patient. Nicole counts out the correct amount of tablets in the medicine store. I have lots of special instruments to do my job. Here are some of them. Stethoscope. I use this to listen to an animal's heart and breathing. Thermometer. I use this to check an animal's temperature. Otoscope. I use this torch to look inside a patient's ears and mouth. Nail clippers. I use these to stop a pet's claws getting too long. Syringe. I use syringes to put some medicines into a patient. Which of these instruments have you seen before? My first appointment. My first appointment is with Flossie the rabbit and her owner John. She sits in her pet carrier in the waiting room. Flossie has runny eyes, which can be caused by teeth that have grown too long. First, I weigh her to check that she is eating well. I use my otoscope to examine Flossie's teeth and to check that they haven't grown too long. Flossie's teeth look fine, so I think she has an eye infection. I give her some antibiotic eye drops. How does a rabbit keep its teeth from growing too long? Flossie also needs a vaccination. Vaccinations protect animals from diseases. I give Flossie the vaccination using a needle and syringe. More appointments. My next appointment is with a dog called Molly. She has been sick and is not eating. I feel Molly's stomach with my hands to check for a blockage. She hasn't touched her food. Molly has a sickness bug. The owner holds Molly still while I inject some medicine to make her feel better. Spike also has tummy problems. He has eaten fruit cake. The cake contains raisins, which are poisonous to dog. I put Spike on a drip. The drip will slowly inject fluids into his body. This will protect his vital organs while he is unwell. What foods can your pets eat and what should they not eat? Scanning. Tony is another vet at the surgery. He is scanning a dog called Tommy to see if she is pregnant. I can see 3 puppies. Tony scans Tammy using an instrument called a probe. This is called an ultrasound. It produces an image on a computer screen showing the inside of the animal. Probe. Elsa has been hit by a car. She has been badly injured. First I send Elsa to sleep, then I use an X-ray machine to take photographs of her bones. This will show me if any bones are broken. I wear a special gown to protect me. It stops my body being exposed to the X-rays. The X-rays of Elsa's bones show up on a screen. One X-ray shows that she has broken her leg in 2 places. Breaks. Have you ever had an X-ray? If so, what did you have X-rayed? Operations. Elsa needs an operation to fix her broken leg. Before an operation, it is important that I wash my hands well. Then I put on a pair of surgical gloves and a clean scrub top. Why is it important for a vet to be clean before they operate? Angie, another vet nurse, is preparing some medicine. This will ease the pain when Elsa wakes up. After I have operated on Elsa, Angie wraps a bandage around Elsa's leg. This will keep the leg supported while it heals. My next operation is on a cat. This operation is called the spay. It stops the cat from having any kittens. Making phone calls. Every day I have lots of phone calls to make. Owners want to know their pets are safe and well. If I decide that a patient's treatment needs changing, I must let the owner know. Owners also ring me for advice. The operation went well. On some animals I carry out blood tests or take some other samples to check for illness. The nurse puts the test results in a file. I look the results up and ring the owners to tell them the news. Sometimes I use a microscope to check for samples of skin for parasites such as lice and mites, or blood for signs of infection. Why do vets use a microscope to look at samples? Out and about. Some pets can't be brought to the surgery. The owner may be too old to travel, or the pets may be too sick. I visit these pets at their homes. In the evenings and at weekends, when the surgery is shut, I often work on call. This means I must keep my phone by me and be ready to rush out in any emergencies. I also visit farms to treat animals such as cows, sheep and horses. Today I am testing a herd of cows for a disease. I do these tests often so that the farmers can stop the disease from spreading. Why do you think the cows are being moved through this metal cage? Helping animals. I really enjoy being a vet. I work with a great team of people who help me do my job. Most of all, I enjoy helping animals get better when they are sick and helping them stay healthy. I really enjoy my job. When you grow up, if you would like to be a vet, here are some simple tips and advice. What kind of person are you? You are friendly and enjoy speaking to people. You are interested in science and how animals' bodies work. You are prepared to work with sick and injured animals. You are practical and like working with your hands. Most of all, you enjoy looking after and helping animals. How do you become a vet? You will have to study science subjects at GCSE and A-level. You will also have to study veterinary medicine at university for 5 years. Answers, page 4. Vets help all sorts of animals, both big and small. Some common animals that vets help are cats, dogs, rabbits and hamsters. Some vets help unusual pets such as parrots and lizards. Some vets help farm animals such as cows, horses and sheep. Page 7. Vet nurses perform a wide range of jobs to help the vets care for sick animals. These include feeding, giving medicines and helping the vets during operations. A rabbit's teeth never stop growing. Chewing on grass and hay wears the teeth down to the correct length. Vets wash their hands before surgery to stop the spread of infection to the patient. Page 19. Microscopes are used to see things that are too small to be seen with the naked eye. Page 21, the cage is used to hold the cows safely while they are treated. Were your answers the same as the ones in this book? Don't worry if they were different. Sometimes there is more than one right answer. Talk about your answer with other people. Can you explain why you think your answer is right? Glossary. Antibiotic, a substance that can destroy and stop the growth of harmful bacteria. Appointment, an arrangement to meet at a set time. Drip, a bag of fluid tube and needle that is used to slowly inject a patient with liquid drop by drop. Exposed, with no protection or shield. Heartbeat, the pulsing of the heart. Herd, a group of cattle or other animals that are kept together. Hospitalized describes animals that are kept at the surgery to be cared for because they are too unwell to go home. Infection, disease caused by germs or bacteria. Inject, force a fluid into the body by piercing the skin. Microscope, an instrument that is used to make small objects look bigger. Operation, to use instruments to repair damage inside the body. Organ, a part of the body that performs a specific job such as the eye, kidney or heart. Parasite, a living thing that lives and feeds on or in another animal. Poisonous, containing poison which can harm or kill. Pregnant, carrying developing young in the body. Prescribed, instructed to use a medicine or other treatment. Sample, a small part of something taken to be tested. Scanning, taking images of the body with special medical equipment. Scrub top, a protective piece of clothing worn by vets during an operation. Surgery, the place where a vet works, also another name for an operation. Syringe, a tube with a nozzle that can suck up or squirt liquid, often fitted with a needle for injecting fluids into the body. Temperature, the level of heat inside the body. Ultrasound, sending waves of sound into an animal to produce an image of the inside of the body. Vaccination, a medicine that can help prevent a particular disease. Vital, necessary for life.